my pleasure to be here and talk about something that is near and dear to my heart, which is developing personal care and independent skills. And in particular, when I'm working with children and adults, I think that building independent skills is one of the most important things that we can be doing as caregivers. And I'm very happy to be talking about it today. So first, I actually just want to start out by providing a little bit of a definition of like, what do I mean when I say personal care skills? It actually refers to a really wide range of skills. It's such a wide range that I'm not going to be able to cover all of them today. I'm going to cover a very small subset, but it includes general hygiene skills. So this could be brushing teeth, could be washing your hands, it could be bathing and showering, toileting independently, which is the majority of what I'll be talking about today, dressing and undressing in order to be a part of the community. Feeding can be considered a personal care skill, which includes feeding with utensils, as well as making your own meals is considered part of personal care. The importance of it is really there's many reasons why it's important, but a couple just to highlight here is that it does decrease dependence on caregiver support. So it makes a child more independent. When I think about the children that I work with who have autism or other developmental disabilities, my goal is always to be as independent as possible, regardless of whether or not they may or may not have autism or may not have other diagnoses involved. The goal is always to be as independent as possible. And in addition, it also really just promotes general health. When we think about being able to eat well and dress and undress and to toilet independently, to have appropriate hygiene skills, it actually can decrease the need for medical visits, so sick visits. I think all of us have been very aware of the importance of washing hands over the last few years and how that might improve health, and also brushing teeth. We also think of brushing teeth as being very important and something that generally improves overall health. And if we can decrease dental visits, some of which are can be aversive, and dental procedures and medical procedures that can be aversive when some of these hygiene or medical issues might get out of control. Personal care skills can help make sure that our children stay healthy. So what am I going to be talking about today? So I'm actually going to start by talking out largely about toilet training, because that is a and personal care, I think, is really important, not only for personal independence, but also it really improves quality of life for the individual themselves, but also the caregivers. And then I'm going to briefly talk about toileting and hygiene issues, and then apply that more broadly to hygiene. So the last two topics I'm going to talk about much more briefly, but I'm hoping that the conversation that I'm able to start with talking about toilet training will kind of lead into those later two issues, and you can kind of see how those things are related, and you can use potentially some of the same strategies, use some of the same ideas that you might be using for toilet training to apply to toileting hygiene related issues, and also more broader hygiene related issues. So let's start with toilet training. And just thinking about this very broadly, the first thing I just want to talk about kind of toilet training in general. So it's important to know, and if you're working on toilet training with an individual with autism or any developmental disability, it's important to know that it may come later for autistic children compared to children without autism. So in non-autistic children, we generally see that toilet training comes somewhere in around the 3-year age range. So that can come much earlier. So we might see kids who are 18 months or 2 years old who seem to be really working on toilet training. It might also be a bit later. So sometimes we see kids who are 4 years old who don't have developmental disabilities or any other neurodevelopmental condition who are toilet training on the later side. But on average, we'll see that it's around about 3 years. But we do expect that for children who have an autism diagnosis, that it is going to come later. That rate, how much later, is pretty variable because there are other things that influence it. So we know that not all children who have autism have only autism. So we also have autistic individuals who also have global developmental delays or intellectual disability or attention deficit hyperactivity disorder. All of these things may impact the timing of toilet training and also whether or not that individual is successful with toileting. We can also generally expect that it's going to take a little bit of a longer time in order to achieve toilet training. There's no real guideline about how long toilet training generally takes for more typical or for children without autism. But for toilet training for individuals who have a diagnosis of autism, we generally see that it might take a year or more of really working on toilet training in order to achieve success. I say this not to discourage you at all, but just say that we really have to keep working. And when you're using some strategies and you're seeing incremental progress is really, really important. It's also important to know that many individuals might obtain control for urine before bowels. So I'm going to talk a little bit about obtaining control for bowel movements, but I'm largely going to focus on urine today because typically we recommend that you focus largely on control for urine before focusing on control for bowel movements. So again, a lot of the things I'm going to be talking about today are urine control, and then bowel movements typically come later. And that's actually true for both individuals who are autistic and non-autistic. That's not to say that there are not some exceptions where there are children who might obtain control for bowels before they obtain control for urine, but that's the typical progression. I also want to make a note here that a diaper prescription is something that you can look into depending on the age of your child. I have found that in the clinical care that I provide, this is not something that many parents are often aware of, but it depends pretty widely on what state you're located in and whether or not you're able to access a Medicaid product. But if your child does have access to Medicaid because of their autism diagnosis, it is possible that after the age of about 4, so above the age that we would typically expect toilet training to happen, they might actually be able to get a prescription for diapers from their pediatrician. If you have a developmental pediatrician that you're working with, that might be the first person to talk to because they might have a better understanding of what the rules and regulations are, since they typically work with children who might be a little bit later to toilet train. But in general, your insurance may cover it if your child is older than the typical age, and they also have a developmental disability. So if you have a child with autism who's over the age of 4 and also has Medicaid, it's pretty likely that you're going to be able to access a diaper prescription. There are some private insurances that might also provide that service as well, but it is very variable. And I would recommend that you call your insurance company. As we all know, sometimes these things add up. I mean, diapers are not inexpensive. So if you're working on toilet training and it's also hard to find sizes that are a little bit larger for some of our older kids. So if you are working on toilet training and your child's a little bit older, I would recommend talking to your insurance company or talking to your child's pediatrician or developmental pediatrician about whether or not you might be eligible to get a diaper prescription and get those covered under your insurance. Before we really dig into some of the behavioral strategies, I also want to note that there are some medical considerations related to toilet training that need to be considered. And the most prominent one is constipation. Constipation is very common in early childhood in general. And we know that autistic children and our children with autism often have higher rates of gastrointestinal problems relative to children who do not have autism. So in the general population in very young children, it's up to about 15% who are going to have constipation. So that's a fair number of children. And generally the onset of constipation is about between the ages of 2 and 4. So right around the time that we're working on toilet training. One of the reasons that we can see that children with autism and typically developing children might have increased constipation around this time is that poor or picky feeding habits, so not eating enough fiber, those sorts of things might worsen constipation. So we think that this is often exacerbating constipation in children of these ages. If you go to a doctor, you might see that your child is diagnosed with what they call functional constipation. Functional constipation just means that there's no underlying medical cause for the constipation. There's not a structural issue that's going on. There's not something else that the doctor can identify other than that the constipation is present and that it's chronic. With toilet training, constipation can be a significant barrier. So if your child has constipation, they're likely experiencing pain associated with going to the bathroom. This can create toileting aversions. So if you have unresolved and very chronic constipation, I would highly recommend that you think about how you can work with your doctor to resolve the constipation before actively working necessarily on specifically toilet training, because it could make the problem a little bit worse. So some children who have constipation may actively withhold their stool because it is painful to go to the bathroom. So instead of going to the bathroom, they will hold their stool. Withholding stool actually exacerbates constipation. So because they're withholding their stool, their muscles in their GI tract are no longer working the way that they should. So their muscles are weakening, and it creates sort of this cyclical process where the constipation was already there. Now they're experiencing pain, so they're withholding their stool, and the constipation continues to get worse. So by having constipation, it might create more constipation. So constipation is one of the medical issues that I would highly encourage you to think about resolving and talking to your pediatrician or your doctor about before proceeding with some of the more active toilet training behavioral issues that I'm about to talk about. Constipation is not just related to bowel movements too. So like I alluded to before, it can create toileting aversions, but it also can impede toilet training for urine and bowel. So it's not just, oh, my child is having trouble having a bowel movement. They might also have some issues with urination because of the constipation. So it's really important to address this issue, and it may require medical intervention. So if it's very severe and very chronic, I highly encourage you to talk to a specialist, including a pediatric gastroenterologist. There are some medical interventions that might be required. There's imaging that can be done to see how severe the problem is. And also there are medications. Sometimes when we take medications for constipation, we think, well, I'll only take it when I need it or when I'm having active constipation. But sometimes it's actually important to be taking it on a regular basis to make sure that the child stays very regular, rather than only taking it when it seems like the child needs it. So working really actively with a pediatric gastroenterologist specialist can be really important, especially if your child is having a combination of constipation and trouble with toilet training. So the first question I think that I often get when I talk to families about toilet training is my child even ready? And so the first thing I think about is are they physically ready? So is their body physically ready to actually toilet train? And that just means, are the muscles of their GI tract ready? So are they able to hold urine? Are they able to hold bowel? So some of the signs of that is that they're staying dry overnight. They're staying dry from naps. They might be staying an hour or two or even more during the day. That's sort of a sign that they're physically ready to toilet train. In terms of being more developmentally ready, they might be requesting that they need a diaper change. They might be doing this verbally or non-verbally. So it could be that they're coming to you and saying potty, or coming to you and saying diaper, or coming to you and just pointing to their diaper. That would be a sign that behaviorally they might be ready. They might have some kind of indicating that they need to use the potty. And one of my next bullet point, that they're hiding for bowel movements. That's a bit of an indication that they recognize the need to use the potty. They're going to someplace that's a little bit more private. Now, that is to say that just because you don't have these clear signs, it doesn't mean that you can't work on some toilet training readiness skills. And as I'm going to try to outline in my next few slides, there are some skills that you can work on, even if you're not quite ready to get to the point where you're actually having bowel movements or urine movements actually on the potty. There are some things that you can potentially work on. Try to get your child ready to try to get your child to that point, so that when they actually seem to be a little bit more ready, that you've already dealt with some of the early skills. So I just put out a list of questions here. So again, when I'm working with families, these are some of the questions that I ask. So I get when I have a family tell me that their child is not toilet trained yet, that's not a lot of information, because there's a lot of steps that come before full toilet training. So it's not, is your child toilet trained or are they not toilet trained? There are a lot of things that are in between. And this is not the order of these questions, while they are somewhat developmental from a lower or early developmental skill to a higher developmental skill. It's not exactly linear. So you might see that your child falls somewhere in between here. They have some of these, but not the other. But these are some questions that are a good starting point. And I would encourage you, if you're working on toilet training with your child, to start with these questions. So the first question that I would ask is your child or the individual you're working with able to sit on a potty chair at all? And that's actually the first thing I'm going to talk about in working on strategies. Are they able to sit at all on a potty chair? Are they able to sit at all for, say, a meal? Are they able to sit at all for, say, a cartoon or a preferred activity? Because sometimes we even need to work on this idea of being able to sit for a longer period of time, because toileting does require that you're able to sit for a certain period of time. And toilet training actually often requires that you're able to sit for a significant amount of time so that we can encourage a success. And if so, where is that potty chair located? Because sometimes it may not be actually in a bathroom. And we're going to discuss that a little bit later too, about helping transition individuals who are not able to toilet in a bathroom actually getting into a bathroom, because sometimes context or the setting or where the toilet or potty chair is located matters. So if the individual is able to sit for a while, have they actually had a success? And the question I ask around this is, was it purposeful or did it just happen on accident? Now, that doesn't mean that, so incidental or accidental successes are actually really, really good signs for toilet training, and they matter and they're really, really important. But it is a different stage in the development of toilet training versus a purposeful, I sat on the potty and I went and it was meaningful, versus I sat my child on the potty and they happened to go. We treat those a little bit differently, but they're both really an important part of the process. If your individual or the person that you're working with has had a purposeful success, so they went to the potty, they seemed to understand that the goal was to actually have a bowel movement or urinate, will they go by themselves? Will they ever take themselves to the potty alone, or will they only go if an adult takes them? So that's another stage in the process. Sometimes that can also, as my next bullet point points out, is sometimes that can be inconsistent. So sometimes it happens that they can take themselves to the potty consistently, and sometimes it's inconsistent. Again, the next bullet point, are they toileting for urine but not bowel? So again, most children are going to toilet for urine first and then bowel, and we deal with those a little bit separately. Sometimes specific, and it's a specific issue that we sometimes see for our autistic children, are they toileting in some environments but not others? So we might see some children who will toilet at home, but they won't go at school, or they'll hold it all through the school day and then they'll wait and they'll go at home. Or if they're in the community, they may not go in the community. So we might have parents who will put their child or their autistic child in a diaper for the community, but then they're able to toilet independently at home. And then related to the broader hygiene issue, we might see individuals who can use the potty consistently, but they might need help cleaning up after, and we'll address that towards the end. So the first thing that I would like to talk about is actually just sitting. So sitting is a required skill for pottying. So if your child's not able to sit, or the autistic individual that you're working with is not able to sit for a few minutes, it's really difficult to help learn that skill of pottying, because you have to be able to sit in order to potty. So the first thing that I would recommend is practice sits. And this is one of those things, like I mentioned earlier, if your child might not be ready for toilet training, but you want to work on some toilet training skills, some skills that might lead to toilet training, you can practice sitting. It doesn't have to be sitting on a potty necessarily. It can actually be for other skills too. I would strongly encourage you to talk to any therapist that you're working with about just sitting in general, especially if right now we see sometimes if a child goes to speech therapy or occupational therapy, they might need to sit in like a high chair that has like a little tray on it so that they can adequately engage in the activity. But toilets don't have high chairs. They don't have a tray that sits over the child. There's no belt on a toilet to help the child stay in the chair. And so we want to try to help them learn how to sit for longer and longer periods of time so that they can successfully use the toilet. And this might start out as just a few minutes or even a few seconds. So right now, if your child is only able to sit independently for, say, 10 seconds or 20 seconds, that's fine. That's your starting point. And you just want to try to build that up over time to get to longer and longer periods. You could also use preferred activities to try to encourage longer sits. So if your child enjoys certain YouTube videos or certain activities that they don't otherwise have access to, I would try to limit those activities to just working on sitting. And it could be potentially on a potty chair. I also would say that it doesn't just sitting on a potty chair. It doesn't mean that they have to pull their pants down. It could just be the practice of sitting on the potty itself. Now, this, of course, depends on the age and the size of your child. So it could be if your child is smaller, it could be that they're sitting on a potty chair. If your child is larger, they could be sitting on more of an adult-sized toilet. But just the practice of sitting at all can be really helpful towards developing toilet training skills. So even if your child is sitting on a potty or a toilet fully clothed and you're just working on sitting, that is movement towards getting towards toilet training. So I often say this in a lot of my talks, is that I always think about where is your child right now and what's the just next step. So if your child right now won't sit at all, my goal is let's just sit for 5 seconds. Let's sit for 10 seconds and we're not even going to pull our pants down. And then if we can get to pulling pants down, well, let's just sit in the diaper. Let's just sit in the pull up. We're trying to just get really more and more and gradually more comfortable with this idea of sitting on a potty. And it doesn't have to be perfect. It doesn't have to look like what we ultimately want it to be, which is sitting, with no diaper, no underwear, no pants on the potty. We just are working on those just next steps. In terms of sitting as well, we do typically recommend that both male and female individuals work on sitting first. Now, if your male child is expressing a preference to stand, it's okay to honor that request, but typically it is a little bit easier to make that transition to start with just sitting, because then all of toileting is sitting, and then you can make the transition towards standing a little bit later. A few things to consider in this process is that there are some comfort preferences and sensory sensitivity. So sometimes toilet seats can be rather cold, and that might be something to consider. We know that our autistic children might have more sensory sensitivities than our other children or ourselves. So trying to be sensitive to what their preferences are. And then also there are toilet seat covers that you can consider. So there are toilet seat covers that are a little bit padded, so it's not as hard of a surface. And also toilet seat covers that are a little bit fuzzy, that might be preferential, but also keeping in mind that if there are fuzzy or padded seats at where the child is being toilet trained, that actually might not be a preference. So trying to figure out where those preferences are for that child. There are also types of seats to consider. So often we think about the potty chair. So the small little chair that we use for typically toddlers is a common first step towards toilet training. One benefit of a potty chair is that you can vary where it's located. I'm going to get into this a little bit more, but ideally we want to potty train in a bathroom. Now we do have children, and I'm going to talk about this again in a later slide, who have an aversion to a bathroom for a variety of reasons. And in that case, a potty chair might be to our advantage because we can work towards moving towards a bathroom while still working on toileting. But ideally, we want to potty train in the bathroom. So if you do have a potty chair and your child is able to enter a bathroom and it's not afraid of a bathroom, I would put that potty chair in a bathroom, and that'll just make that transition to using a larger toilet a little bit easier. There are some children, though, who do not prefer the potty chair. They would prefer to use the adult-sized toilet. If the child is a little bit smaller, you can consider having a toilet insert so that they don't fall in the toilet when they're working on potty training. Or some children might just prefer to just use the adult-sized toilet. So again, sitting is one of those skills where even if you're not sure if your child's ready to potty train, you can work on these skills even before they're ready to potty train, so that when it feels like they are ready, you already have kind of built the groundwork for the potty training skills that you need to consider. So the next thing I want to talk about is, okay, you have a child who's sitting on the potty, but they're not successful. So you might sit them on the potty and they just do not go. The first thing that I'd recommend in this case is to consider transitioning to regular underwear. The purpose of using regular underwear is that it helps children recognize that they've actually had an accident. It does provide some kind of feedback, some physical feedback that they've had an accident and that they maybe should have gone to the bathroom. It is if you want to put a pull-up or a diaper on over the wear. I completely understand you do not want to ruin your floors or your furniture because your child is wearing regular underwear and they are not close, but putting that regular underwear on and then the pull-up or diaper on still provides that physical feedback without ruining your sofa, I guess I should say. If your child is able to help pick out the underwear, that is for the better. I have a note at the bottom here of this book by Azrin and Box called Toy Training in Less Than a Day, because a lot of these ideas are taken from that book, and a lot of the toilet training for very young children are from this group. But really, the next thing that this group recommends is really just to try to select times and dates to actively work on toilet training. So it might be that you're going to spend one Saturday afternoon, and the goal is to work just on toilet training. And during these times where you're actively working on toilet training, the first thing is to give the individual lots of fluid. So we want to have lots of opportunities to have accidents or lots of opportunities to have success. And then while you're giving this child a lot of fluids, you're giving them all the juice they want, all the water they want, we take them on timed bathroom breaks. So every 15 to 30 minutes, we have them sit on the potty for 5 to 10 minutes. The goal of that is to actually try to have an accidental success. It could be a deliberate success. So we might have a child who really, really has to go and initiates, but a lot of times that first success is by accident. And that's fine. That's okay if that first success is by accident. So we want to take them on timed bathroom breaks. And if that success occurs, so if they actually do urinate in the potty, even if it's only a little teeny tiny bit, we're throwing the biggest party in the whole world. It's super exciting. It doesn't matter if it was an accident or not. We really want to try to communicate in some way that was what we wanted, that urinating in the potty was the right thing to do. Now, if the child does have an accident during these times where you're really working on building that connection, we still try to take them to the potty. So if the child has an accident, we might take them to the potty anyway, still have them do a sit just to try to build that connection. That means if something happens with urine, then it always is associated with the potty. So even if it's an accident, then we still take them to the potty. And if your child is able to help clean up the floor, help change their clothes, we want them to do that. And it's important to remember that very, very normal. So try not to get discouraging and they just are not getting there. And like I mentioned earlier, it might go for to fully get toilet training. So don't be discouraged by a lot of accidents, especially if you're using this method. It's also important to actually try to get everybody on board. And by everybody, I also mean the school. You can actually have timed bathroom breaks written to schools IEP. Typically, we'll see in the potty that you're for physical physical indication your child needs to use the potty. So you might see that you're preempt that. Really what we're trying to teach them is that, hey, I recognize that you're feeling something and you're feeling that you need to go to the potty and I'm taking you to the potty. Sometimes we have to help make that connection for them. Again, the initial successes might seem accidental. We're going to provide praise regardless. At the bottom here, I want to note a really common issue that I hear, which is that sometimes the child seems to hold their urine, and then the minute the parent puts the pull-up or the diaper back on, immediately they use the restroom. So it just seemed that the diaper was what initiated it. Now, we know that a lot of our autistic children have trouble with transitioning. They have trouble with change. So they may have gotten a bit attached to having a diaper. In this case, we recommend something called diaper fading. And what I would recommend trying, at least in this case, is taking your child's diaper and cutting a hole in the bottom of it. So they might not realize that there's a hole there, but you've put a hole there. And so when you take them to the potty and you put them on the potty, the urine will still go into the toilet. And then you just make that hole a little bit bigger and a little bit bigger until they're just kind of wearing what seems sort of like a diaper belt. They're still feeling that pressure from the diaper, but they're not actually wearing a diaper anymore. So it's a very slow process of getting rid of the diaper kind of from the bottom up. I would recommend talking to your behavior specialist or another behaviorist who's working with your child if you're going to go down that route. Okay, the next thing we sometimes see is that we're getting a child who's having success, but they always need prompt. So when we take them, so if a parent takes them on a timed bathroom break, or if the school takes them on a timed bathroom break, it always goes well, or it generally goes well, but they always need that prompt. They will not take themselves by themselves. So what we call this sort of in my world, we call this prompt dependency. So they always need a prompt. It is difficult with toileting to work on this, but I do want to let you know that this is not unique to toileting. So needing prompts also occurs in a lot of other skills. And I want to give you a couple examples. So this also occurs when our children are developing language skills. So if you've had a child who was in speech therapy, you may have noticed that for a while they were using single words, but when they were in the speech therapy with a speech therapist, they might use a phrase. So they might come to you and they would say milk, and then you would tell them, well, say, I want milk. And then they would repeat after you, I want milk. That's prompt dependency. So they could engage in the skill, but they always needed your help. The same thing is true for other things like anxiety. So for our, not just autistic children, but for young children who are dealing with anxiety, we might need to remind them of the skill that they already have. So they have the skill, they know to take a deep breath, but they don't know when to do it. So we have to remind them to do it. So it's not unique to toileting. It doesn't mean that they don't have the skill. It's just they need a little more support along the way in order to get to that skill to what I would call mastery. So it's a natural part of the progression. I think it can be very frustrating to get to this point where it feels like you're so close, but the child still needs a lot of help. But I would encourage you to think of it again, just like a part of the progression from not having the skill at all to having the skill but always needing help to mastering the skill and being able to do it independently. And again, this phase where there's this prompt dependency, it might last longer than it may have lasted with children who are not autistic. So prompt fading is an important part of this. So it's, again, unlike some of the others, because it might be more difficult because sometimes we have to catch that the child needs to go to the bathroom, again, like they're doing those potty breaks, the potty dance rather. And again, timed bathroom breaks may need to stay in place for an extended amount of time. Don't give up on timed bathroom breaks as part of this process. I also would try to think about what prompts are you using. So when you take the child to the bathroom, I would try to use minimal prompts. So you might just guide them there and try to give them the minimal amount of sort of physical prompting that you might need to give them in order to actually use the toilet, and have them do as much of it as they can completely independently. So if they're able to pull their pants down, pull their pants up independently, have them do whatever they can do independently. You're just trying to prompt them to actually use the potty. You're not trying to assist them with the whole entire process, but just what do you need to help with? I also want to touch very briefly on toileting regression, because we do see this at times as well, where it looks like the child is doing really, really well with toileting, and then they seem to go backwards. The most important thing is that it's often related to recent stressors. So I would think about, is the child had a move? Is there a new baby sibling in the house? Or have other things been going on that might be causing stress? And how can you normalize the environment as much as possible? So trying to get back to a routine as much as you can, and going back to strategies that worked before. So the need for support, especially during times of high stress, might ebb and flow. So you might find that an individual needs more support at certain times and a little bit less support at certain times, and it might very much be related to stress. But don't hesitate to go back and try strategies that had worked before and use them now, even if you don't feel like you should have to because they already mastered it. It's okay to go back and say, we're going to just get this moving again. So overall, some additional just general tips and strategies. The first one is just to go slow. So, if like I mentioned before, for autistic children, it might take over a year to actually achieve full urine and bowel control from the time that you start toilet training. So trying to go as slow as just go slow. There's no need to rush it. It's not going to happen overnight. It's not going to happen in a week for most individuals. So go very slow, go at your child's pace, let your child kind of guide the pace that you're going at. Live modeling can also be something that's helpful. So if there's a close relative, if that is a mother or a father or a sibling or other close relatives who might actually show the process of toileting, that can be helpful for some kids so they have an individual to imitate. We know that visuals tend to be very effective for toileting. So you can use timers and schedules to prompt bathroom breaks. I'm going to show a couple of examples on the next couple of slides. It's also important to consider receptive and expressive communication. So I get this question a lot. Well, my child can't talk. There's no way that they could tell me that they need to use the potty. Like I've talked about before, timed bathroom breaks kind of takes that out of the equation. So it's, you go from taking the child on timed bathroom breaks and then start initiating. So again, I would encourage you to start working on toileting, even if you're not at the point where they can actually tell you that they need to go to the potty, but use language that's as simple as possible. And if they're using any kind of augmentative or alternative communication device, you can build potty requests into the iPad or into the picture exchange communication system to make sure they have a strategy to let you know they might need to use the potty. It's also important to note that changing clothes and diapers and pull-ups should be neither positive nor negative. I think when babies are quite young or infants, we tend to kiss their feet, and we try to make diapers and pull-ups a really fun experience. And when we get to this point, we're really working on potty training. I try to think about it as, changing clothes after an accident or changing a diaper. It's just a fact of life. What we need to do is we need to change. It's not necessarily a good thing. It's not necessarily a bad thing. It's just what we need to do when it happens. So do not punish your child for having an accident. I know that it can be frustrating, but to the extent that you can kind of control how you feel about it, that's really helpful towards moving that forward, and just using matter-of-fact language. So, oh, you've had an accident, we need to get changed. And it's just a fact of life. It's just matter of fact. Getting everybody on board can be really helpful. So making sure that everybody's handling this in the same way. So if you're using timed bathroom breaks, make sure everybody is using timed bathroom breaks. And finally, I do want to note that it is okay to take a break. So if your child is making just minimal to no progress, or if you think things are going backwards and your child is getting increasingly frustrated, or they seem to be developing new aversions, or they're very upset with being sent on the potty, it's all right to take a break. Take a couple months off. Again, if they're making slow progress, I would encourage you to keep going. But if there's no progress, or you think it's going backwards and you feel like it's important to just take a break, it's okay to take a break. I'm just going to show you here just a couple of examples. So this is a sample visual schedule from the Autism Treatment Network. And again, you can break this down even further. So this is a very broad visual schedule that it says, sit on potty, wipe until clean, flush and wash hands. You could break this down even further if you wanted to, including pulling down pants, pulling down diapers, sitting on potty. Another visual schedule example would be to build bathroom breaks into your child's overall schedule. So if you're doing timed bathroom breaks, so in this example, there's a bathroom break at the beginning of the schedule and a bathroom break at the end of the schedule. So we often think about schedules as being what we're going to do all day. And that might be, at school, we do, again, snack and arts and crafts and puzzle, but building bathroom and trips to the bathroom into the overall daily schedule can also be helpful to help normalize bathroom as part of the day-to-day. We also sometimes see children who, they've gotten control for urine, but they're still struggling with bowel movements. Again, I want to emphasize that going to a pediatric gastroenterologist could be important. But a couple of additional tips here is to make sure that the child's feet are on a surface. So if your child is using an adult-sized potty, but they're shorter, they might need a stool because having pressure with your feet can assist with bowel movements, making sure they're getting adequate hydration and fiber. Also, I would recommend that you just take a note of when your child is typically having bowel movements. If they're regular with their bowel movements, generally you would expect that they're going to be having them at the same time every day. So you might build that into your timed bathroom break. So even if you're doing bathroom breaks every hour, but there's a different time of day where there's typically a bowel movement, you could add on a timed bathroom break at that time. We'll often see too that when children are starting to be ready to be toilet trained, that they might hide when they have bowel movements. And I would encourage you to let them hide in the bathroom. So if they hide, say, in their bedroom or they hide under the table, redirect them to the bathroom. So they start to build that association with having a bowel movement with actually being in the bathroom. And once they do have a bowel movement, if it is happening in the diaper, of course, going through a diaper dumping procedure, which is where you take the diaper off, you have them help you put the bowel movement into the toilet and flush the toilet. So that they make that connection with bowel movements, go in the toilet. Now, I just talked about flushing, so it is important to note that sensory sensitivities here are a significant problem. This can include noise and light, among many other things. We do sometimes see that children will have even an aversion to their home bathroom, and sometimes it can be related to bathing aversion. So if your child is really, really struggling with bathing, we think about children who have trouble with water being poured over their head, or they don't like being in the bath. They might have a problem being into the bathroom anyway. So using an alternate bathroom might be helpful. So if you're really trying to work on the bathing aversions, if you have one bathroom for bathing and one bathroom for toilet training, you might be able to make progress in toilet training, even though the bathing is still an issue because you have two separate places for that. Again, I mentioned earlier that sometimes the potty chair can be to your advantage in this case, if you have a younger child or a child who's a little bit shorter, because you can put that potty chair wherever in your home and then slowly move it towards the bathroom. So it might be that the potty chair is in the living room, and then it's in the hallway, and then it's in the doorway right outside of the bathroom, and then we slowly move it towards being in the bathroom. And then consider working on just one thing at a time. So if we're working on sensory sensitivities, we might be working on that first, or if we're working on bathing related sensory sensitivities, we might be just working on that. So working with your providers about what are the priorities right now, what's going to be the best for the quality of life for the child. Is it toileting right now, or is it bathing right now? And try to just work on one thing at a time. Sometimes we can overwhelm our kids by trying to accomplish everything all at once. Now, public restrooms are another issue, and it is a broad issue because whatever public restroom you go in, it's going to be different. Automatic toilets, I think, are the biggest problem that we often face because they're unpredictable. I don't know about you, but when I use an automatic toilet, I never know when that automatic toilet is going to go. And sometimes it's very loud. Now, I've been in enough public restrooms to kind of have a sense of like, I know when it's about to happen. I can hear the toilet sort of start to flush, but sometimes it starts to flush before I'm even finished. And sometimes it doesn't flush at all. And I have to try to wave my hand and get it to flush, or I try to find the button. And I can only imagine that if somebody has a sensory sensitivity, that must be incredibly difficult to have. Not only I know that this aversive thing is about to happen, but I don't even know when it's going to happen. So that's a huge barrier for a lot of our autistic children. The toilets, in addition, can be very loud. There's also automatic sinks and hand dryers. So there's lots of things that are playing into difficulties with using public restrooms. So overall, some just general thoughts about what we can start to do. So one is if there are light sensitivities, trying to dim the lights at home, or using a night light instead of turning the lights entirely on, or using one light instead of all of the lights. If that's something that is sensory sensitivity, consider practice trips to a sensory-friendly public restroom. This might take a little bit of investigation to figure out where those are located, but there might be some more sensory-friendly public locations, because if your child has had a bad experience in the community, it might just kind of like propagate that they just don't want to go to any public restroom. So trying to find one that feels a little more friendly. It could be one at school. You can build that into the IEP, that there is a bathroom option at the school that the child could go to and start practicing this idea of community restrooms. Again, it might take some investigation on the part of the parents or the caregiver to find a restroom that's a little bit more sensory friendly, but trying to start there so that there's at least a door that opens. And again, be prepared with changes of clothes and pull-ups, and try to avoid embarrassment if an accident does happen. Again, we don't want to punish, we don't want to embarrass our children for having accidents. Toileting hygiene is the last point I'll talk about here before I get into a little bit of briefly into a little bit of broader hygiene. But again, potty training generally comes first before there is any adequate ability to clean or wipe appropriately. So it's okay if potty training comes first, and that you might need to then assist with wiping and cleaning for a more extended period of time. Again, even though the toilet training overall might come a little bit later, and so we'd expect that adequate ability to clean and wipe might come a little bit later too. We also know that our autistic individuals might struggle a little bit more with motor skills, fine motor skills, and that might also impact their ability to adequately clean and wipe. So we need to be thinking about those things, especially with how we're targeting that skill. But some interventions that you could use would be just generally looking at visuals. So having a visual of labeling what's clean versus what's dirty. Be providing very specific instruction about the amount of toilet paper that's needed for each go. We also can think about what's a concept called backward chaining, which I'm going to talk about in the other additional slides, which is that we have them just do the last step. So we might help them with a lot of the wipes. So let's say that we're going to do 4 wipes. So we do the first 3, and then we have them do the last one, and then we help them build up towards doing all of them. Again, we want to make sure that we're continuing to monitor this until it's mastered. And then there might be some appropriate accommodations, like providing baby wipes instead of traditional toilet paper, to just help them be more successful. And the last thing I'm going to touch on just very briefly, so I have some time for some questions, is other hygiene. Encouraging good hygiene and building hygiene habits is important from very early childhood. We have to teach a lot of things, like items that are needed to be used, especially things that need to be used on a daily basis, like a toothbrush and soap, and that hygiene becomes increasingly important over time. So I often give a talk about puberty, and hygiene becomes very important during puberty, where it might be a little bit easier in early childhood to say, well, we don't need a bath every day, or we don't need to do certain things every day. But once you get older, some of these things do become more important over time. So trying to build those habits in early childhood is something that we can do to help improve our children's quality of life. So how do we make a routine? Again, we want to have visuals and structure as much as possible that helps communicate what the individual needs to do to engage in a hygiene habit. What tools do they need? So what do they actually need to use? So if you're brushing your teeth, there's a different set of tools that are needed than if you're washing your hands. There's also a different set of tools that are needed if you're actually taking a bath. And then as you get older, there might be a different set of tools that are needed for things like shaving, or for a morning routine, and for an evening routine that might build upon that. But trying to set the basis, particularly in earlier years, can be very helpful. The sensory sensitivities can be important here. We also want to consider any kind of motor difficulties that the individual may have. And I'll talk about that in a minute. And again, we want to use routine to build skills. So if you're using a visual schedule of any sort, or any kind of schedule with the individual that you're working with, trying to build hygiene tasks into the routine can be helpful. So it's not just about what activities do we need to do today, but also what's part of your every single day, everyday routine. Hygiene kits are a good way to clarify some of these expectations. So for example, you could have a morning kit that is the hygiene that's needed for the morning, which might include, say, a toothpaste and a toothbrush and some kind of maybe moisturizer or face cream, or that might be more appropriate for an older child. But for a younger child, maybe a toothpaste and a toothbrush is sufficient. And then you can build into that hygiene kit. Could also have a bathing kit that includes everything that might be needed for a bath. As kids get older, we want them to be increasingly independent with bathing. So trying to have everything in sort of a singular kit so that they know exactly what they need to use for their bath or their shower can be very helpful. It just clarifies expectations. So what do I need? What do I have to do? And how do I know when I'm finished? It gives just some additional structure. You can also have a specific schedule. I've had families use like a CD, and they have like, a certain number of songs that are played, and that's how long the teeth brushing needs to happen. Or sometimes if the child is taking too long in the shower, once the CD is over, that's when the shower should be done. Having some kind of a doll that, their different limbs they can take off and say to make sure that they have, washed every body part. So they might have washed their face, and then they've washed their arms, they've washed their legs. Even having a list, it really just depends upon the skill set of the specific individual. And it also just helps break large tasks like taking a bath or taking a shower into smaller parts to know what each step is. This is an example of just task analysis. So this is an example of washing hands, and it just breaks down the task overall into very, very small parts. So we would think that washing hands, that is a singular task, but there's a lot of different parts to washing hands. Like you have to turn the water on, then you need to get your soap. You might need to then put your hands, you have to rub them together, then turn the water back off, and then dry them. So if there's a lot of struggle with the washing hands, thinking about trying to break it down into smaller parts to clarify expectations, and then not having a need to remember every single step along the way. So just a few common hygiene hangups. So for bathing, using an action schedule that shows which action or steps to take. I talked about this before. So what body parts to wash, what order they need to be done in. You can laminate the schedule and hang it in the shower. For your older kids, they can cross it off if they have like a marker pen. And then options for hair and body washing. So, sensory sensitivities are something to definitely consider. So using a pitcher instead of a faucet or a shower head for washing hair might be a little more sensory friendly for some kids. And then thinking about whether using like maybe a loofah or a washcloth or a different objects to actually wash the child might be helpful. And then for teeth brushing, using sort of a vibrating or a weighted toothbrush might help for brushing teeth for individuals who have more fine motor issues, and then a visual timer or music timer to help children know how long to brush their teeth. Again, we want to do slow practice here. There are also special needs dentists, and I would encourage you, if you're having trouble with brushing teeth and things like that, to find a special needs dentist in your area who might be willing to work in a really slow way with your child towards getting a full dental visit. I have a few resources here, but I will stop, and I think we have just a few minutes for questions.
Great. Thank you so much, Dr. Taylor. I think this was really informative, and we definitely had a lot of questions come in, but like any good presentation, you answered a lot of them already. So while we do have a couple minutes for some questions, I think like I said, a lot have been answered already, but one question that I saw come in from quite a few attendees. So you have any tips for helping when a child is already toilet trained, but there's the issue of staying dry overnight?
Yeah, so that's more of a that can be more of a physical issue. So they're not waking up. So the typical thing that we do is, one, try to limit liquids at night. So not giving them any liquids before bed for at least an hour, or trying to limit that as much as you can. And so the child's not waking up. So there are strategies where you can wake we can actually rouse the child. So it depends upon what time the accident's actually happening, but you can consider, the first thing I would do is just try to limit liquids before bed. That would be the first thing. The second thing I would do is to try to rouse the child a couple hours after they're asleep and take them to the bathroom to try to help them make that connection between waking up and needing to use the potty. They also make, now I think they cost a little bit of money, so I'm hesitant to recommend them specifically, but there are a belt, like there are pads that sense wetness, and they have an alarm to help wake the child up. So ideally what we want to do, what we want the child to do is recognize in their sleep that they need to wake. And so these pads have an alarm, and they'll sense wetness, and the alarm will go off. And so that will wake the child, and then they'll go to the potty. Again, I think they might be a little bit on the pricier side. So the first thing I would do is limit liquids. And then, if you're staying up a couple hours later than your child, then wake them up an hour or two after and just rouse them a little bit, take them to the bathroom and bring them back to bed.
Great. Before we go on to more questions, could you just go back to the resources slide? I think some people wanted to just see that. And I guess while we keep talking, we can just keep that up.
Sure.
Thank you. Another question. So you talked a little bit about how, whether it's the parent or a sibling can sort of show the toileting actions. Do you have any specific verbiage or phrases that have been useful when toilet training as well?
I don't have specific verbiage because that's going to really depend on your child's, the autistic child's own receptive and expressive language skills. So I would tailor it towards that individual's level. So if right now the way that you're communicating, the way they're understanding is in single words, I would use single words. If they're using phrases, I would use phrases. So you might have somebody say, look, potty. That would be maybe an example of a lower, sort of lower language level. A higher language level might be like, I'm using the bathroom, but I would really tailor it to how your child is communicating and try to match the language that they have and also match how you're communicating with them.
Great. And towards the end, you talked a little bit about hand washing and understanding that this one single action is made up sort of a bunch of smaller actions. Any suggestions on how to reinforce the importance of this step, in the larger toileting schedule, and also sort of piggybacking on that, ways to overcome different sensory challenges that may come into play with hand washing?
Yeah. Okay. So I'll talk about the first one first. So, I hope it's okay that I go back. I'll put the other one back up. So
Definitely.
You'll notice that this task analysis is put behind the sink itself. So the reason that it's posted there is so that it's a reminder, and in the moment of what the child's supposed to do while they're at the sink. But you can build hand washing into a bigger schedule. So you could have a schedule that says like toileting and then hand washing. But when they get to the sink, they have this reminder of what are all the steps involved. So it's, if your child is using schedules, you could have this sort of like broad stroke schedule of like, what are all the big steps we have to do? But you could have these reminders along the way of what are the little steps. So you might have behind the sink, you might have, okay, so we know that we have to wash our hands, but these are all the little steps we have to do to wash our hands. And that's posted behind the sink as a reminder. We know we have to shower, but within the shower, we have this list of all these things that we have to do. And then, we know we have to potty, but in front of the toilet, I may have these lists of all the things I have to do. Like I have to pull my pants down. I have to sit down. I need to potty. I need to wipe. And then I pull my pants up. So you could have sort of these little schedules, which I refer to as task analysis, within these broader schedules. And Dominique, can you remind me of part 2 of that question?
Yes. So just any suggestions with like sensory challenges when it comes to hand washing?
Yes. So I would, so one thing I would do is since hand washing can be difficult because we do have some kids who are very sensitive to it. And then we also have some kids who really, really love water. And so that can make it challenging because sometimes there can be sort of an obsession with water, which also goes along sometimes with toilets. And then we do have some kids who just don't want the water to be turned on. That might be noise related. Sometimes there are, especially automatic sinks, or we sometimes noise that are really, we have sinks that can be really noisy, or just the sound in general could be really aversive. So I would think about what are other ways to wash hands. I mean, if your child is at the point right now where they will not turn on a sink, I would think about using hand sanitizer or wipes. And that will at least help get the child used to having that feeling of wetness on their hands. You could also consider having like a bowl or a pitcher where you're pouring water over. I think it's very individualized. I would recommend talking to any kind of behavior analyst that you have about different strategies. But and also just having somebody brainstorm with you, like, what are all the different ways that we could do this that would at least move us in the right direction? So again, hand wipes, hand sanitizer. Can we use a bowl or something, or can we use a bowl or a pitcher instead? Is there a different sink that we can use just to get used to doing it? And then we can work on expanding the environments where it's okay.